So first of all, let's talk about how do we bill for the bilateral drug. And most Medicare MACs do accept if it's the same drug. Let's say it's Eylea. You can bill the Eylea HCPCS code and double the units. It has a medically unlikely edit, or MUE, of doubled units, in this case 2 milligrams with the MUE of 4. That means you can bill 4 units to bill for the 2 vials all on one line. But what about if it's 2 different medications? That makes it a little bit more complex. The 2 different medications do need to be on 2 separate lines, but then also make sure and look at the payer policy for any additional documentation required. Palmetto, for example, one of the Medicare MACs, has an Eylea policy that points out that they do not expect to see different medications in each eye. When it happens, they expect to see really good documentation as to why 2 different medications are being used. Now, Dr. Shah, what would be your recommendation of the type of documentation we would see to help support different medications in each eye?
Yeah, so again, for some of these, if it's different documentation, if it's on the chart note, different disease can be helpful. So for instance, when you're talking about wet versus dry AMD, that's a useful kind of distinction. That allows you to kind of link it, separately. So that can be helpful. But again, the challenges that you mentioned are real, and I think they're honestly going to be a little bit more complicated. There are medications in clinical trials that are actually delivered as 2 successive treatments, one after the other in the same eye. And as these start to come to fruition, it is something that will have to kind of be addressed. But those are a few scenarios where you kind of have to deal with those challenges.